had to quit my job as a nurse. I couldn't find my way home.
You can lose your mind.
Headaches that will blow you apart.
Fireworks going off in your head or egg beaters in your head.
Pain that was not human.
Miserable 24 hours a day.
And you feel like you're dying and you want to die.
It's devastating.
It will kill you if you don't take care of it.
And turn into that chronic entity, which is a monster.
Lyme disease is a spirochetal infection called Borrelia burgdorferi.
That is carried by arthropods and can be transmitted to humans.
Lyme is a spirochete like syphilis. It can go anywhere because it can burrow.
Various ticks carry Lyme disease. There is the deer tick, the Lone Star tick, the American dog tick, and the wood tick. So the tick would attach to you. It would inject an anesthetic-like substance into you so you wouldn't feel the bite of a tick, and pass along multiple infections. It can be just Lyme disease, but we're finding more often that it's not just Lyme disease. Most people carry at least one co-infection.
There's malaria-like infections, there's parasites, and these can all be part of the mix of the disease entity called Lyme disease.
It's estimated that it's 20-fold or more greater than West Nile and AIDS combined.
The classic progression of Lyme symptoms was the rash, the development of flu-like symptoms, whatever they might be.
A bullseye rash is Lyme disease. No laboratory tested is needed.
But you can also develop symptomatology without any rash.
Lyme disease has a very long list of up to 68 different symptoms.
My eyesight went really bad. To brain fog, brain doesn't tell your legs how to walk down a step.
Some people have such extreme weakness that they're just unable to function.
Cognitive effects, memory loss, psychological effects, including irritability, rages, central nervous system effects when it's in its later stage, numbness, tingling, hyperacusis, or a very extreme sensitivity to sound, sensitivity to light, joint pain, muscle pain, bladder issues, gastritis or stomach issues.
Total inability to speak, talk, hear, see.
And it can mimic the most hideous diseases, namely ALS, Huntington's, MS, severe rheumatoid arthritis.
The CDC would recommend the two-tier testing of the ELISA test followed by the Western blot. The ELISA test is often negative, and people know it's often negative. So then if you test negative on the ELISA, if you don't even get the standard conventional Western blot test.
You can get a negative, for instance, ELISA, and still have a positive Western blot.
So we have a test on our market in conventional medicine that is faulty at best because it doesn't pick up the Lyme-specific bands. So a lot of times they're misdiagnosed and don't know anything about Lyme disease, and a lot of people get misdiagnosed as an autoimmune disease.
Some physicians are willing to treat it, but they won't treat it unless they have a positive test. I just stated the positive test is a hit and miss thing.
If you catch it early, you should treat, and it's just Lyme disease, with the medicine that the doctor thinks appropriate for you for at least 3 weeks. If you still are showing symptoms, there are a lot of doctors who will continue that on for a while. If you've got co-infections and they don't recognize those, that's where the real issues come in.
And then it's different if you've had the disease in your body longer than somebody who recognizes the symptoms and gets treated right away. Perhaps then a month course would be effective if they didn't have any other co-infections or anything else. What would you choose? The Infectious Disease Society of America, Lyme disease is difficult to get, easy to treat, or would you choose treat 2 months past resolution of your symptoms? I chose to treat. I'm doing much better, and I do have a life now.
I took a walk on the beach last week, and I never thought I'd be able to do that again. I can think. I can have a conversation with you without having to take 45 minutes to find a word. It is treatable, and that's the benefit of this disease. It's treatable. It's in the parks, and it's in our yards. It's not just in the forests.
Avoid the long grasses. Yes, ticks can be in your front yard when the grass is short. They don't like the sun, they like the shade. You need to wear a DEET repellent or permethrin you can spray on your clothes to protect themselves. They tell you to wear light colors. White would be a good color to wear so you can see them on you. The biggest way to prevent Lyme disease is to check your body every day. Do a tick check. They like to hide in the groin area, behind the ears. They like the head. They always try to make their way up towards the head. Between your toes, you need to check the nooks and crannies because they like to hide.
Get a tweezers, get as close to the head of the tick as you can. Gently back that tick out and watch for signs or symptoms. A fever, a flu-like symptom, a rash occasionally, aches and pains. But not only then, a year from now, 2 years from now, because this disease lays dormant in your body for long periods of time. It doesn't all of a sudden always how you've got it right away. It can come down the road.
You do need to see a trained Lyme literate practitioner to get the care you need to overcome Lyme disease and have the best aspect of your life. So check your kids, check your pets, check your family. Lyme disease is real, and it does take your life away.